All right, so it's time to deal with an aortic aneurysm in life and death. As for equipment, things are pretty much the same here. Instead of a cauterizer, you have a ligator. I may or may not be pronouncing that correctly. It serves the same purpose as the cauterizer to tie off blood vessels and make them stop bleeding. You've got a gut bag here that's used for one specific purpose later on in the operation. That will become obvious when we get there. And here you've got the Dacron, whatever, graft for actually putting into the aorta to reinforce the aortal walls since they've become weakened from the aneurysm, and a heparin syringe, which is used for when we actually get down to the aorta. It's just a blood thinner and prevents blood clots and embolisms, that sort of thing. So first, as usual, wash, gloves, and cover the area with antiseptic. And your surgical drape. There we go. That's all good. Now oh yes, inject antibiotics. Turn the anesthetics on and put blood into the IV. Now when we incise here, just do straight from top to bottom. Don't need to do any sort of diagonal thing like we did before. Just like so. Make sure you don't cut the drape. And the clamps here are at an angle because of the angle you have to incise. So just clamp them off as before. And use the ligator. Boom, 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 and so on. Got them all. Okay, that's what we want to see. So this is all pretty much the same as before, just with vertical incisions as opposed to a diagonal incision. Missed that apparently. Wipe that down and retract. Same thing goes here. Make the incision as straight as you can. Stop up those bleeders. I missed that one apparently. Yeah, you get a little blip noise like I said before. And there's one more bleeder appearing up here. Oh, two more. I thought there should be more bleeders. Sometimes they don't appear immediately. And okay, we've gotten all the bleeders. That's one reason it's important to make sure that your assistants tell you that you've gotten all the bleeders. Actually, you get to choose your assistants. I don't know if all choices of assistants will tell you that you've gotten all the bleeders. I'm not sure about that. You usually see that, I find. So now, here's some muscle that we cut through. It doesn't bleed, so you just get right to the retracting. Now here's some more tissue layer. We take care of it the same way we did in the appendectomy operation. Scrape with the scalpel near the top center. Raise it with the forceps. Poke your hole, and you cut with the scissors. Now here, you're not supposed to, but I think if you just click and hold and then drag down, it works reasonably well. I've found that if you click repeatedly, it tends to make a very jagged incision, and then they get mad at you and make you do the operation over again. Then you just retract that as normal. Move this red stuff here is the guts that I mentioned before. Move that out of the way. Oh, got bradycardia here, so some atropine. You can see the aorta underneath already. And grab our guts bag, and put it over like so. Now we do the same procedure. Okay. Same procedure here. I'm going to refill this with blood. Same procedure as before, making very careful you don't pierce the aorta, because piercing the aorta is definitely not what you want to be doing right now. All right, and cut. Boom. That could have been straighter, but that's fine. Retract, and the very first thing to do when you get here is to inject heparin. That's a blood thinner, prevents embolisms, which are basically traveling blood clots. Those are very bad. Now click once to mobilize and lift the aorta. It puts this rubber tubing around here. Now you need to clamp off the two iliac arteries down here and the main aorta up here, along with the mesenteric artery on the side. And once you've got that clamped off, you have to work rather quickly, or else the patient's blood pressure starts to go haywire. So clamp the aorta, or do the iliacs first, then the aorta, then that, and you cut off the mesenteric artery with the scalpel right about there. That will start to bleed, whether or not you can see it, so clamp it off and do that. Now we can cut, and the positioning of this incision is very important. It can't start or end too high or low, or else you won't be able to get it open for whatever reason. So retract, and there's a bunch of blood clot in the inside. Just click to get rid of it, and there will be a bleeder either there or at the spot below, or both. So take care of those. Irregular heartbeat. Now we put the graft in. Just sort of drop it into place. More irregular heartbeat, whatever. And put 3 sutures at each leg. 3 there, 3 there, and 3 there. Now click once at each leg to close the legs of the aorta and iliacs around the graft, and then put 3 more sutures at each leg, and you're pretty much done now. So you unretract the aorta, close it up with tightly spaced sutures. Now we can remove the clamps again from the iliacs first and then the aorta. Click that to return the aorta to the abdomen. I can't even talk. And I'm going to put a saline solution in place. And now we just get the hell out of here. Unretract. Suture. From here on out, it's pretty much exactly the same as before. Remove the guts bag. And suture, suture, suture. Unretract. You know how this goes. Same thing here. And then the skin staples. And once you've done all of that, make sure they're roughly evenly spaced. Once you've gotten all that done, you should be finished with the operation. If the head of surgery isn't feeling too picky that day, he'll let you pass, at which point you will have basically beaten the game. You'll get a little fanfare and it'll show like a diploma or something. I can't show that to you in this video because once I ended the operation, DOSBox changes video modes. But, oh damn it. Once you've gotten here, that's pretty much the end, and you can turn off the gas. Hopefully you will have done well enough. That's all for now.